Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. What happens when you combine the extraordinary soft tissue detail of magnetic resonance imaging with the cell-level metabolic tracking power of positron emission tomography? You get PET-MRI, one of the most advanced hybrid imaging technologies in modern medicine. Today, we are exploring hybrid PET-MRI. We will explain what to expect as a patient during a combined scan while breaking down MR-compatible detectors, attenuation correction, and spatial fusion for our technologist community. For patients undergoing a PET-MRI scan combines elements of both nuclear medicine and MRI into a single visit. Your appointment begins with a small IV injection of a radiotracer, most commonly a sugar-based molecule called FDG. You will then rest quietly in a private uptake room for about an hour, allowing your body to naturally absorb the tracer. Next, you enter the PET-MRI suite. The scan itself typically takes between 45 to 60 minutes inside the scanner bore. Because it captures both metabolic activity and anatomical structure at the exact same time, you get the benefit of two comprehensive diagnostic exams in a single session, with significantly less overall radiation exposure compared to traditional scans. For our technologists and student community, combining PET and MRI into a single gantry required a major engineering breakthrough. Traditional PET systems rely on photomultiplier tubes, or PMTs. However, PMTs use accelerated electrons inside vacuum tubes, which are completely disrupted by the strong static magnetic field of an MRI scanner. To overcome this, modern PET-MRI systems use solid-state Silicon Photomultipliers, or SiPMs. These semiconductor-based detectors are completely immune to magnetic fields up to 3 Tesla and beyond. Their compact design allows PET detector rings to be mounted directly within the MRI gantry, enabling true simultaneous data acquisition without crosstalk interference. One of the biggest technical challenges in PET-MRI is MR-based attenuation correction, or MRAC. In PET/CT, correcting for 511 keV gamma ray attenuation is straightforward because CT Hounsfield units directly reflect tissue electron density. MRI signals, however, reflect mobile proton density and relaxation times, not electron density. Bone and air, for example, both produce zero signal on routine MRI sequences despite having vastly different attenuation coefficients. To solve this, technologists run specialized Dixon sequences that separate tissue into 4 main tissue classes: air, lung, fat, and soft tissue. Modern platforms also incorporate ultra-short echo time sequences or deep learning algorithms to generate synthetic CT maps, ensuring highly accurate PET estimable quantitative calling. Why go through the complexity of hybrid PET-MRI? The clinical benefits are immense. Because data is acquired simultaneously, motion artifacts between the metabolic and anatomical datasets are practically eliminated. This provides unmatched spatial co-registration. In neuroimaging, PET-MRI allows clinicians to evaluate metabolic brain function while assessing structural micro-changes simultaneously. In soft tissue oncology, such as prostate, gynecological, and musculoskeletal cancers, PET-MRI DMRA prior cancers superior lesion characterization while significantly cutting patient radiation exposure, making it especially valuable for pediatric patients requiring longitudinal monitoring. Hybrid PET-MRI represents the cutting edge of diagnostic imaging, merging molecular physics and magnetic resonance to transform how we detect and treat complex diseases. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.